So this video is going to cover theory and talk a little bit about research and evidence-based practice. So our learning objectives, we're going to define nursing theory, and we're going to look at comparing, contrasting qualitative and quantitative nursing research, list components of the nursing research process and explain their importance, identify the PICO method for formulating a question for guiding literature search, and then discuss how you might integrate nursing research into your nursing practice. We're just introducing a little bit to you now. You will have a whole class with Ms. Smith later on in the nursing program about nursing research, and I know she's given you a little book to carry with you at clinicals just so that you can start to identify a problem that is happening in clinical and see maybe if that's something you would like to do your project on. Research really guides every single thing that we do. We don't do things just because that's the way it's done and that's the way it's always been done. There's a reason behind everything we do. There's a reason behind why you wash your hands for 20 seconds. There's research that tells us and guides our practice. That's called evidence-based research or evidence-based practice. We do everything based on why the literature, why the research tells us that that is good to do. If you go to work at a teaching hospital, they're going to be very innovative in that. And for example, UT Medical Center, they do a lot of research. They have research committees. As a new grad, you may look into implementing a problem in an actual research project. We implemented a lot of things or trialed a lot of products at different times based on nursing research. So as a little bit of a start to that, we're going to talk about nursing theory. And nursing theory is just a way to view a phenomenon. It's an organized set of ideas and concepts that help find meaning in experiences and then organize our thoughts. Also develops new ways to do what we do. So you all have all done your research poster presentation now on your nursing theorist and the importance behind them in healthcare. You looked at different things that they did, and you looked at, why they were important in healthcare. So they were all nursing theorists. So why do nurses use theories? They're a guide to assessment. They're a guide to help ID problems, and then a guide to help predict human behavior. So some different components of a theory. You have a phenomena or the subject matter of a discipline. When used in this sense, they're called a phenomena of concern. Think of the phenomena as marking boundaries of a discipline, making one discipline unique from another. We also have assumptions, and those are ideas that we take for granted. They are presumed ideas that don't get tested. So in a theory, they are the ideas that the theorist or researcher presumes or they take for granted to be true and they don't intend to test with research. Can be statements about concepts or relationships between concepts. Your concepts, those are the mental image of the phenomena or the subject. It's formed by generalizing an abstract idea from your experiences and observations of events, objects, properties, and it exists as a symbol, could be word or picture in your mind. So whenever you're thinking about these clinical problems as you're occurring, when you're in clinical, like you may see a problem. One project I did was how long we leave IVs in place in people's arms or in their wherever they may have them at. And looking at, do we really need to change them every 4 days, or is there evidence that says they can be left in longer? Definitions, these are the meaning. They may be general or they also might be specific, but it's the meaning of a term or concept that sets forth the concept's characterizations or indicators, the things that allow you to identify the concept. A theoretical definition refers to the conceptual meaning of a term, and the operational definition looks at how you would observe or measure the concept whenever you're doing research. We also have statements or propositions, and those describe links among the concepts of a theory. They systematically describe those concepts and the statements. If you look at them as a whole, they make up the theory. So the theory, framework, model, or paradigm, whenever you're looking at the three, the differences in these, if you look at the paradigm, it's a way of thinking that's shared by a community of scholars that are studying and working on the same phenomena. If you look at the conceptual framework, that one is a set of concepts that are related to form the whole or the pattern. They tend to be broader and more philosophical than your theories. And then the model, this one is a symbolic representation or a framework or concept. Can be a diagram, graph, picture, drawing, physical model. And then a conceptual model is a model that's expressed in language. When we look at how different theories are developed, first of all, you have an idea to explore this problem through research. So you're going to be working in the clinical setting and you're going to identify an idea about something. And you're going to explore that through different research. They can also be developed through logical reasoning. So the purpose of your logical reasoning is to really develop an argument or a statement based on evidence that will result in a logical conclusion. So we have inductive reasoning, and this is where you're bringing in information to make a generalization. It's more specific to general. So think there's specific data out there, and I need to bring it in to make my generalization. Deductive reasoning, this reasoning starts with a generalized reasoning and then you deduce it. So it's more general and moves to a specific. So your inductions and deductions are not facts or truth, but they're more of like the point you want to make in the direction to go seeking truth and figuring out the truth. You can make connections between different ideas when you're helping to develop a theory, and then the more information you have helps to support your conclusions. So if you look at the picture, this is a good description of your logical reasoning and looking at inductive and deductive. So the first picture is going to be inductive reasoning, and the nurse is looking at the patient, and she's looking at the chart, looking at her overall assessment, and she sees elevated white blood cell counts on the chart. She sees a temperature of 101, and then they have a wound that is red and oozing pus. So her conclusion is that the patient may have an infection. So she went from looked at patient-specific data and went more general as to, I see these specifics happening with my patient, and then I'm going to go to the general aspect of it and conclude that they have an infection. Whereas if you look at the nurse assessment picture on the other side, the deductive reasoning, she looks at and is thinking about, she knows the infection causes an elevated temperature and white blood cell count, and they also have a diagnosis of a kidney infection. So in her conclusion, she's starting out general and getting it down to specifics. So she's going to look at monitoring the temperature and the white blood cell count. So in a way, we want to think about this as far as your critical thinking goes. When you're taking care of patients, if you're looking at what their diagnosis is and what you know is going on for them, in return, you're going to take that to the specific level and see what you're going to monitor in your assessment. So the question, the nurse notes that this patient has pitting, pedal edema, crackles, and an elevated blood pressure. Concludes that the patient has fluid volume excess. And this is an example of, would be B, your inductive reasoning, because we're drawing in a general conclusion from the pattern found in the patient information. So we're going to look at different nursing theorists, and hopefully this should be a little bit of a review from you because you all looked at different theorists, and hopefully you got to go around and look at other people's posters but we're just going to briefly talk about each of the different theorists. The one in the picture is Patricia Benner, and we'll talk about her again in just a minute, but she created the novice to expert learning idea about new nurses. And the picture there on the PowerPoint slide talks about the different growths that you have as a nurse or in any career. You go from novice, which you have no professional experience, and then going to expert. And you have a real grasp on the situation, and you have the accurate data, and you're an expert in that field. She has a really good book about novice to expert nurses, and if you ever get an opportunity to read it, it would be really good just to kind of see where you stand at different points in your life. So different nursing theorists that many of you all did presentations on. We have Clara Barton. Clara Barton was really instrumental in the Civil War and was the Red Cross founder. Dorothea Dix, she was particularly important with the mentally ill, developmentation of mental institutions and asylums. Florence Blake, she was very instrumental in pediatrics and family-centered nursing care. Florence Nightingale, hopefully all of you all know a whole lot about her now, but she was instrumental with clean environments and promoting healthy environments and providing healthy food to patients and identifying the pre-germ theory. Florence Wald, she was the founder of the first hospice program and was very instrumental with hospice. Linda Richards, she was the first trained or professionally trained nurse. Margaret Sanger was important and made contributions with birth control, sex education, and also abortion. Mary Breckinridge, she was a midwife and created the Frontier Nursing Service and served in rural areas of Kentucky. There's also Frontier Nursing University that is in the area that she practiced. Mary Seacole, she was a war nurse and instrumental during the Crimean War. Virginia Lynch, she was a forensic nursing founder. So just to review some of those, Florence Nightingale, the clean environment, healthy food. Virginia Henderson, she was important with the nature of nursing and described a nurse's function, identified 14 basic needs that we have. Patricia Benner, she created the caring model in the idea that caring helps nurses connect with their patients. Also created the novice to expert learning idea that we just mentioned. Madeline Lineger, we talked about her a little bit in our last class whenever we talked about cultural care, and she developed the culturally competent care model. Rosemary Parse, she looked at a person's life as ever-changing and personally defined through one's own perspective of a goal as they see it. And then Dorothea Orem looked at the self-care deficit, and nurses care for those who can't care for themselves. So these are just the big ideas or topics that each of these theorists really were instrumental in. So the nurse incorporates Hispanic beliefs about hot and cold into her plan of care for her client. The nurse is providing care based on which nursing theory of which of these people. And that would be Madeline Lineger. When we look at Maslow's hierarchy of basic human needs, I believe they talked a little bit about this in your test-taking strategy seminar, but this theory really identifies 8 different levels of needs and identifies that lower level needs must be met to some degree before the higher needs can be achieved. So there is a link to a video in your PowerPoint that I'd encourage you to look at. But if you look at the picture there, our physiological needs: food, air, water, temperature regulation, elimination, rest, sex, and physical activity. we have to meet the needs on that level to some degree before we move up, before we can meet the needs of a higher level. So, nurses require a safe working environment. To begin, they are required to take breaks to eat, use the bathroom, catch their breath. So, in order for us to provide safety for our patients, we have to take care of ourselves first. We also want communication solutions that allow them to collaborate and interact more effectively. Your safety and security is also important. Protection, emotional, physical safety, security, order and control. Then you have love and belonging. So as you move up the steps, we want to think we've met the basic needs first. So think about when you're taking care of your patients, making sure that they have water, offering water to them. Those things are important, making sure they're comfortable before we meet the needs of the higher level. So this looks at each of those a little bit further. Whenever we're looking at the basic physiological needs, we look at respiratory effort and status, cardiovascular health, GI needs, foods, fluid, nutritional intake. If you look there, respiratory effort, think airway. That's why whenever we teach airway, breathing, circulation. But there may be questions that you may have to incorporate this too and think about priorities in the sense of Maslow's hierarchy. So we're going to talk just a little bit briefly about research. So whenever we look at research, we're going to look at a research design and different ways to look at data and research. So quantitative, if you look at quantity, you want to think numbers. You're gathering data in order to best generalize the results to a similar population. But if you look at what type of research it is, if you're primarily looking at numbers and findings with ranges, that's quantitative research. Qualitative research is more of opinion and experience, and it focuses on lived experiences of people. This one is gathering data by interviewing real people about different experience they've had in the interest that you're studying. So if a nurse researcher who intends to interview clients about the factors that influence their compliance with insulin therapy, summarizing the data as themes, this would be quantitative research, true or false. This one would actually not be. If you look at the lived experiences or interviewing clients, think qualitative research. So different steps of the research process. Like I said, this is just an overview as you'll go more in depth. As a new nurse, you won't particularly be doing or performing research, but you want to have a general idea of the steps so that you know the process that gets involved. So you're going to select and define the problem you wish to study or the problem you wish to look at. You're going to select a research design, and then you collect data. Then you analyze the data, and then use the research findings to help implement a solution. So whenever you are conducting research, there are certain rights that the participant must have. Because if you are conducting research, you're going to have to have a set of people that you may be conducting the research on. So they will have these rights. They'll have the right to not be harmed. And this outlines the safety protocols of the study. And you have to indicate potential harm to the participants. If at any time the preliminary data indicates that they may have a potential harm to happen, the study must be stopped. They have a right to full disclosure, and that is where they have a right to answer questions like what's the purpose of the research, what risks are there any benefits, will they be paid, what happens if they get sick, who do they contact for questions and concerns. So all of those aspects would be disclosed to the participant. You also have right to self-determination, and this is really your right to say no. So at any time in the study, participant has the right to stop participating. You may take care of patients in the hospital who are part of research trials and research studies. So you want to be mindful of this as the nurse. You want to support them in their aspect, but you don't want to allow anyone to coerce the participant into remaining in the study. They also have a right to privacy and confidentiality. They have the right to have their identity protected. Generally, they're going to be given a code number rather than identified by name. Institutional review boards, often called an IRB. Every hospital, university, or place where federal funds are involved has an IRB. It consists of healthcare professionals and people from the community who are willing to review, and they look at the research proposals. So you have to come up with a proposal to do the research and get it approved by the IRB. And this really protects the research participants from harm and ensures that the research is of good value. When identifying your PICO question, it's going to be in this format. So you're going to look at the population, that would be your P, the patient or the population, your intervention, comparison, outcome, and then the types of studies. So as you start to do research, or whenever you do take the research course, you will create a PICO question. And that's just identifying all of these parts of the research that you want to do. And you're identifying what kind of problem that you have. Analyzing research, this is part of like your literature review. You're going to look at many different articles. You're going to look at all the research that has been done. You're going to look at what is the book, journal, or article about as a whole, how it was developed. You're going to look at what it really says in detail and in how, what their main ideas are, what their arguments are. Is the book or journal true or in whole or partly true? And you're looking at, is this of good value? And is it significant? Is there any way to use the information to help me improve patient care or improve my research? And this slide just talks about different levels of evidence that you can find, and it's leveled 1 through 5. Level 1 is more of your experimental study, randomized control trial. Level 2 is a quasi-experimental study. Level 3, non-experimental study, where they really do a systematic review of the other evidence. Level 4 can be an opinion of respected authorities. And then level 5, based on experimental and non-research evidence, includes your literature reviews, case reports, and some of the others. So research utilization, the reason that we conduct research is to establish that evidence-based practice, what we are aiming for and what we should be doing. We should have evidence for everything that we are doing. The evidence-based practice should really guide our care and guide every decision that we are making in healthcare. So just as a review of our objectives, we've looked at what theory is, and we've looked at, the different types of research and how you're going to integrate that into your nursing practice.